Hi, Alan from World Acupuncture here, just answering a question from Sergio on our forum regarding the treatment of hyperallergic and hyperactive 2-year-old child. The question goes much like this. Funny thing, since I started participating in this forum, I keep getting cases that I never thought I would have. The 2-year-old son of one of my patients almost died last Friday due to a severe allergic reaction to coconut powder. Likely an ambulance, or fortunately an ambulance, arrived on time. Yesterday he again had a similar reaction after eating a cookie. His mother swears to have triple checked for any trace of nut in the ingredients. Prior to that, the boy did not have any allergic symptoms. He was sick for the last couple of months with a cough, nasal congestion, throwing up, alternate low-grade fever with chills. Right now he's okay, but the allergies become prominent subsequent to this his health, his compromised health over those last couple of months. In general, he's an extremely hyperactive kid. The mother is having a really hard time trying to control him. Sometimes she even has to tie him up because he is losing totally the control, jumping and banging his head on the wall. I need your help, Alan, or anyone else who has expertise in this kind of case. It is safe for me. Is it safe for me and the child to try and give acupuncture? Is it better not to risk that, considering the severity of symptoms? Doctors are saying there is nothing to do. The only hope is that he will outgrow the allergy. As for now, he must have always close to him a shot of cortisone and 15 minutes to get to hospital in case of the same reaction. Sergio, yes, there is quite a bit we can do here. I have been treating a family of now 3 children, the eldest of which experienced similar allergic reactions to peanuts. I think the parents went to Thailand. We went over to Thailand in 2006 and they bought the little boy a flute. Unbeknownst to them, that bamboo flute had been coated with peanut oil, and when the child put the flute to the lips, they had a massive allergic reaction. This child too tends to be hyperactive. There are 2 specific treatments. It's a little bit hard to nominate which one would be the most beneficial. Certainly there is a case for the liver deficiency treatment, the liver 8, kidney 10, using the water points of the liver and kidney meridian, and also a strong case here for spleen deficiency using pericardium 7 and spleen 3, the earth points of the spleen meridian. With the hyperactivity of the child, it may be very, very difficult to use needles, and in fact, according to Ikeda Sensei, the points aren't really active on a child until they reach about 7 years of age. I have, however, found in my clinical experience that in particular with this child and a couple of others that I've treated with similar conditions, that they have responded very well to the usage of the points, as well as the Shonishin treatment of the affected meridians. So from that perspective, I would suggest that you use the Shonishin instrument, similar to the one that I demonstrated at the workshop in Prague. I would, at this stage, start with a liver deficiency root treatment. Using, as I said before, the water points of the liver and kidney meridian. I would use fairly, when I say strong, dispersive in a rapid Shonishin type of treatment on the gallbladder meridian and the stomach meridian of this young child, and also on the large intestine meridian on the arm. That's a rapid, repetitive type of movement that you use to bring up the ki, and you get quite a red welting type reaction to that. You only need to spend maybe 30 seconds to a minute or minute and a half on each of the meridians, just working through them and bringing up the red or welting reaction, which is a releasing of the heat. There does appear to be a fundamental deficiency, and it is quite possible that the fever that the child suffered during that couple of months of illness has sapped the fluids from the liver. This would be my recommendation at the moment. However, as a backup treatment, if the response of the child is not as positive as you would like, you may try the spleen root treatment. So you do the root treatment first. It's best for the parent to be holding the child when you treat them. They'll need to keep the limbs still, and especially when you're doing the Shonishin. I wouldn't suggest at this stage the usage of needles, but as I say, a Shonishin instrument where you can actually stimulate the point without penetrating the skin. Also, in conjunction with what I've just suggested, I very strongly recommend the same type of action down across the neck and shoulders. Again, we're releasing the heat from the upper jaw and stimulating the function of the lung meridian to spread the wei qi and the nourishing qi out, and to help release the deficient heat that's been built up in the yang meridians. In my reply to you on the forum, I've also included a link to a number of video demonstrations of Shonishin acupuncture. Sergio, I hope this is of benefit. Please stay in touch with us on the forum and let us know how your treatment progresses, and I'm more than happy to do everything I can to help you to effect a positive treatment outcome. This is, and in regards to the severe allergic reaction to coconut and peanuts, I would think that this would be something that perhaps would alleviate as the child gets older, but with the acupuncture we can only do our best to support the immune system and ameliorate the very powerful reaction that this little one is experiencing to these particular substances. Cheers, Sergio, and thank you to anyone who's viewed this video. Appreciate the time, appreciate your commitment. Look forward to chatting with you again soon. Alan from World Acupuncture saying good morning from Rainbow Bay, Australia.